Hey everybody, we're going to go ahead and get started. It's 12 noon. Welcome to the American Heart Association's Get With the Guidelines Coronary Artery Disease webinar. This is the second webinar in a three-part series. For a full list of all the upcoming webinars, visit www.heart.org/SWA quality. The third webinar in the series will be held on October 17th. Please visit www.heart.org/SWA quality for information on how to register. Before we get started, we would like to go over a few housekeeping items. To avoid background noise, all lines have been placed on mute. To ask questions, you can unmute your line by pressing *6 or type in the Q&A section of WebEx. All slides and handouts will be sent to attendees within a week of the call. And please also visit www.heart.org/SWA to view the recording of the webinar. I am pleased to announce that Kristen Waller will be leading today's webinar. She is the Director of Quality and Systems Improvement for the American Heart Association for the state of Arkansas. Before joining AHA, Kristen was the STEMI and Chest Pain Center Coordinator at a STEMI receiving hospital. She is a nurse and an experienced data abstractor, having abstracted for the NCDR Action Registry in her previous role. I will now turn the webinar over to Kristen.
Hello, everyone. We're going to get started today with the patient management tool. But first, I just want to remind everyone that the American Heart Association offers a suite of healthcare quality improvement programs that helps ensure consistent application of the most recent scientific guidelines for heart disease and stroke treatment at more than 2,000 hospitals nationwide, as well as in outpatient settings. We do have a systems of care mission lifeline approach for EMS providers, referral hospitals, and receiving centers. We are currently celebrating 10 years of Mission Lifeline with our hospital reports, regional reports, and Lifeline recognition analysis. For 2017, Get With the Guidelines CAD is free, and if you enroll by November 1st, you will receive a $500 discount on the 2018 annual fees. Here is the pricing for 2018. If you do direct data entry, it's $2,750 if you enroll by November 1st. If you use a vendor, it's $2,500. And then if you participate in the static quarterly reports, there's no charge if you enroll by November 1st.
Hey, Kristen, real quick, sorry for the interruption. I'm going to move a box on the screen real fast. 1 second.
Okay. While she's moving that box, here's how to enroll and Get With the Guidelines. You can go to heart.org and you can search for Get With the Guidelines CAD.
Okay, Kristen, you should be able to advance the slide now.
Okay. Are you, which slide are you seeing?
How to enroll and Get With the Guidelines CAD.
Okay, I was just making sure.
Thanks.
Audrey, I'm still seeing you. Okay, I'm going to take control back now, okay, Audrey?
Yes, ma'am.
Okay. I'm sorry. Okay, here we go. The vendor updates. The following vendors are actively working with Get With the Guidelines CAD and are approved vendors at this time. If you currently use a vendor to enter your data into Action Registry, they are working on their end to be able to enter your data into Get With the Guidelines CAD as well. You could contact your vendor for more information. The American Heart Association is pleased to confirm that Get With the Guidelines CAD is a data solution for chest pain center accreditation offered by the ACC and AHA. What is Get With The Guidelines? So Get With The Guidelines brings the guidelines to the bedside faster. It's a data registry that hospitals enter data related to the patient's stay and adherence to the clinical guidelines. It's a low program cost, and there are also marketing opportunities available to be recognized by the AHA. So now we're going to dive into Get With The Guidelines CAD, the patient management tool. The very first thing you need to do once you get started with Get With The Guidelines CAD is watch a couple of training videos. They're available on the community page where you'll see where the arrow is. There's an advanced reporting and a downloads training video. The advanced reporting video is about 24 minutes, but it's always best to watch the video and know what Get With The Guidelines CAD is capable of instead of going in there and just entering data and trying to figure it out on your own. If you'll take 24 minutes, it will save you a lot of time. And then the data download tool video training is about 14 minutes. And as a former abstractor and coordinator, I was so excited to see this video. The Excel spreadsheets that it would create for the coordinators. I know a lot of chest pain STEMI coordinators, not only do they enter into a data registry, but they also keep an Excel spreadsheet on the side for themselves that has arrival time, EMS, first medical contact time, things like that. And it's something that they keep up with in addition to the registry. Well, it's available to enter the patient into the registry and then download this Excel worksheet and save you time. It's already done for you. And I'll show you later in the webinar how that works. You'll also want to either print the coding instructions or they're available with just a click of a button if you have a question when you're trying to code a patient or figure out what's included or excluded. The coding instructions are readily available. There are abstraction forms available for those that like to abstract on paper. I personally like to abstract on paper before I entered into a registry, and some do not. We do have a senior QSI director who recommends abstracting at least 30 charts on paper just to get familiar with the information that you need to abstract and what you're looking for. If your doctors are documenting things in an easy-to-find place, you could probably abstract directly into the registry. But if you're having to go to medical records and dig in charts and really search and look for what you need, you would want to use this blank abstraction form. There's also a patient management tool user manual. You can print that out, or it's available. Okay, so to get started on the community page, after you're done with those two training videos, you want to select CAD and the silhouette with the legend over here showing that that's a new patient. So once you click on that patient, you can begin entering a new patient. This is the admin tab, and you will see some things that are not bolded. That means that it is not required, but you can certainly enter that information and track it for yourself. Anything bold is required for Get With The Guidelines, and anything with a little caret is used for the Mission Lifeline measures. And this little button with a circle and a C inside will clear, like if you select male or female or unknown and you just want to, the next one. So you'll see things that you've already been entering that you would find necessary: date of birth, arrival time, your admission date, race, and your diagnosis. This drop-down bar allows for STEMI or non-STEMI, or sometimes you have those patients come in and the doctor never really diagnoses them as a STEMI or a non-STEMI. They just put AMI, and you can't find anywhere in the chart where it's specific to one or the other. And so there is a place where you can select AMI, STEMI, non-STEMI, unspecified. On your pre-hospital arrival tab, this little tab right here, you click it and it will fill in the date for every single one of those fields. So you don't have to waste your time entering the date each time. You just need to go in and select the minutes. There is a place up here to track the EMS agency by number. So later on you can go back and run reports by certain EMS agencies. Maybe you're needing to give them feedback for their Mission Lifeline Award status. And the same for tracking by referral center if you want to compare your referral centers. It's not in bold, but it is available for you for tracking purposes. Also on the pre-hospital arrival tab, there's a place for EKG, first, date, and time, the arrival symptoms, current medications they're taking, did they get their aspirin within 24 hours, are they a smoker? So as you go, over to the right side of the page is an errors and warnings tab. And you can leave it minimized or you can click on it and it will drop down and let you know what you're missing so you can correct it. And if you've left anything blank, you'll know to go back and fill that in before you click over to the next tab. Under the hospitalization tab, there's this select all active date and time fields, and you'll want to use that anytime anything's done on the same day, you know, unless something happens around midnight where you're using two different dates, then this tab will come in handy. Anytime that you document that there was a delay or some reason why there is an exclusion, you want to check why. You need to be able to give the reason why, and it has to be one of the reasons available in order for you to not fall out of the measure. Okay, so if you're a PCI center and you did not give thrombolytics, and you need to go and check expected door-to-balloon time of 90 minutes. Or if they showed up at a referral center and received lytics, and just click why they did not receive primary PCI, which is thrombolytics administered. Just make sure anytime there is a no and they're asking you why that you select a reason why. Okay, and then we have the discharge tab and all the medications listed. And, of course, cardiac rehab. We want to get them to cardiac rehab so that they can begin an exercise program and lifestyle modifications. They can receive education concerning their new medications and any changes they need to make, how to control stress. So we've realized how important cardiac rehab can be in a patient's recovery and keeping them well and out of the hospital. So that is a measure for Gwtg guidelines and Mission Lifeline. There are some optional fields available. If you do site-specific tracking, something that's not available within CAD, but your site is wanting to track it, there are 3 optional fields available. Now, after you've completed all the tabs, the admin, the pre-hospital, arrival, hospitalization, and discharge, the next tab is the measures tab. And you just want to click calculate, and this is what drops down. So on this particular measure, you'll see that all the green measures were met. There are no red measures, so that's a good thing. Anything grayed out did not apply to this particular patient. They were excluded for whatever reason. So this one was a door in, door out. So the primary PCI did not apply to this patient because we were doing a door in, door out to balloon in less than 120 minutes. So on a different patient, we clicked calculate to run real-time measures and allow for data review before we actually submit the patient. And so we see a lot of green, but we also see some red. And so we want to go click over to the tab. We know that we can look at the discharge tab for the statin, and see, did we leave it blank, or maybe we clicked no and we need to dig a little further into that chart and see if maybe the statin was prescribed at discharge and we overlooked it, or the same with the ACE there. So we need to look at some discharge medications. Once you're done with everything, you can select complete, or if you need to go back and look for some more data, you can leave it incomplete. But before you submit it, you want to click print after saving, and that's going to print your report. So that blank data abstraction form that you probably filled out by pencil will actually print out, it will generate a report with all of your information in it. So once you're ready, you can select submit. And this one's just showing where when I did those, calculated the measures, I see that the EF was 30, and so they should have been given an ACE or an ARB on discharge, or at least documented if there was a contraindication, and cholesterol medicines should have been prescribed as well. And here is an example of the paper version that prints out when I showed you that button to select print before hitting submit. You can see it's got everything rolled over on this particular patient. The physician provider MPI was not bold, so it was not required and it's not there available to see. But this is just the beginning of it, just a sample of what you could print out. And then you could use this if your hospital does peer review of the cardiologist, or maybe they want to see for themselves the report, or maybe for your STEMI meetings. This would be helpful. Okay, so you've entered that patient, completed it. The next icon, the double silhouette, is for all of your patients if you want to select to view all of your patients. And this is what you will see. There will be a list with all the IDs, the dates, and you can click on the date to open that patient in the patient management tool. There is an option to delete a patient. Maybe you entered someone that you thought was a STEMI. You spent all that time extracting the chart because they had a STEMI diagnosis, and then you realized that they really weren't a STEMI. They really weren't an MI. It was just an error. Or for whatever reason, if you need to delete a patient, you can click on that, and it will verify that you, in fact, want to delete that patient. Or if you need to change their patient ID number, you can do that here. If you accidentally typed it in wrong or switched your numbers around, you can change that with a click of a button here. The next icon shows the bar graph, and that is for reports. You can select that to run your reports, and you can run reports immediately after entering patients. And here is an example of some of the real-time reports that you can receive. As far as the receiving center, you're looking for that primary PCI in less than or equal to 90 minutes, or if it's EMS, first medical contact, the goal is still less than or equal to 90 minutes. Did they get an aspirin at arrival and discharge, a beta blocker, a statin, adult smoking cessation advice, or if we were going for the first door in, door out to balloon of less than or equal to 120 minutes. If this is a referral center entering into Get With The Guidelines CAD, we are looking for an EKG within 10 minutes of arrival to thrombolytics within 30 minutes, arrival to PCI transfer within 45 minutes, an aspirin at arrival. If for whatever reason this patient does not transfer to a PCI center, then we would look to see did they get an aspirin, a beta blocker, and a statin, and smoking cessation advice on discharge. We would look at those measures as well. And then we can also run real-time reports for non-STEMIs. when you click on the reports icon, these are the options that you get. Once again, you have a user manual available to help you. It's right there. You can audit reports. You can see who all has done a report on your hospital. There may be multiple people within your facility that enter data or run reports, and you can track those. If you want to run reports for yourself, you can do configurable measures reports. And you can choose monthly, quarterly, annually. You just have drop-down boxes for those. And then the measure, let me go back one. And you can select a measure. You can select achievement measures and look at all of the measures at once, or you can drill down if you want just the door to PCI, or did they get a beta blocker on discharge, whatever it is that you're needing to look at. Maybe you did the achievement measures and you see where you're falling out, and so you want to focus on that. Or maybe a specific question has been asked by a cardiologist. They want to know a specific measure, so you can do that easily for them. You can format it. There's a bar chart, a line graph. You can do select by patient. If you want to look at patients individually, you select in this format box. And then we can compare. We can just select my hospital, all hospitals, hospitals within your state. If you have a region, you can compare your hospital to national, state, and regional benchmarks in real time. So you can select just one or multiple. You just hit Control and click on each one that you want to do. And you can save that report as well each time. You can save it to your computer. You can save it within the CAD PMT, either way. So we have filters for comparison. We have arrival day. I know a lot of hospitals do awesome Monday through Friday, and then maybe they struggle on the weekends because the cath lab has to be called out, or there's not somebody there on site 24/7. They're on call. So you could filter by arrival day, age, gender, race, arrival mode. Maybe you just want to look at those that arrive by air, ambulance, or walk-in. You can separate those out, or you can compare them all. You can filter by discharge status or physicians. If you have multiple physicians in your group and you want to look at one particular one, you're able to do that right here. So once you generate your report, this is what will pop up. So this one I selected achievement measures, and I wanted to look at all of them. So you'll see different color for each measure, and right here there's a line missing. So this particular measure did not apply to this hospital. So right here we have primary PCI in less than or equal to 90 minutes, and they are at about 75% of the time, and we want everyone to meet the 85% of the time goals. So we can look and see, well, why isn't there a yellow line? And that's arrival to thrombolytics within 30 minutes. So this is a PCI center, and they don't give thrombolytics, so that's why that one doesn't apply, and there's one missing from there. But we can look and see where we're falling out, and we can go back and drill down if we'd like. And then below that bar graph, there will, each one is broken down, and it has a description of the measure, how many applied, you know, if anybody fell out. So 6 out of 8 here, and we're only at 75%. So we need to go back and look, do a patient drill down and figure out why. So I would select, for the measure that I want to look at, I would look specifically at primary PCI. And then instead of selecting bar graph, I would select patient. And then in that same report is an overall Mission Lifeline receiving composite score. So So this is for a PCI center, and out of all the measures, they are meeting 39 out of 45, so they're at 86%. So their composite score is good, but they just need to drill down and look and see the things that they need to work on individually. So here's my patient drill down. For this particular patient drill down, I wanted to look at an ACE or ARB given at discharge. So I'm looking over here, and you can see all the ones that are included or excluded, and there's a whole list that are excluded. And you can look over here and see their EF. I'm sorry, let me see if I can enlarge that just a little bit. So their EF is okay. It's over 40, but these two up here, we had one with 30 and one with 35. And they were not given an ACE or an ARB on discharge, and we looked to see if they were contraindicated, and we selected no. So this we could select on that particular patient, and it would pull up that patient in the patient management tool, and we could look and see which doctor, which patient that is, and then maybe we need to take that to the cardiologist, or if we have hospitalists doing discharge orders and prescriptions, and maybe we need to talk to them or the nurse practitioners or even case management. We need to say, hey, look, this patient should have been given an ACE or an ARB on discharge, and they were not. And this can all be done immediately. You can take this feedback immediately. Okay, and here are regional reports, what one would look like. We do require that there be 6 hospitals in a region in order to run a blinded report, although if all of your hospitals in your region agree and there are less than 6, then we can possibly create one if everyone is in agreement to do one. So here we're looking at first medical contact to device median time in minutes. And this is your EMS time, your ER time, and your cath lab time is how that is broken down. And it's broken down by quarter and by hospital. And you can compare your hospital with the next. There are also opportunities for a super user account to run statewide reports and regional reports as well. Some hospital systems have multiple hospitals in their state within the same system, and they can compare. And also, your health department may want to be able to view a statewide report as well. And then the last icon available in CAD is a little toolbox, and you can select that for resources, and you will find a link to frequently asked questions and answers about CAD and all of your blank forms and things that you need to print out as well. So back to the downloads video that I mentioned in the beginning. It's a 14-minute short video that explains how to create this Excel file that most coordinators are already keeping up with and creating on their own. You can go in and filter exactly what you want. Once you save it to your computer, you can edit these to say what you want. But this one has, and I've split this up just to fit it all on the same screen, but this one has the ID, the date of birth. I selected arrival date and time, EMS first medical contact, dispatch time, EMS arrival time, departure time, predestination, or destination pre-notification. And so everything that you're already having to go in and enter separately is automatically created for you with this download that you can do. And down here, if there's an outside hospital, it pertains to these 2 patients, their arrival time, their transfer out time. So we have first EKG, when it was transmitted, cath lab activation, and so if those abbreviations aren't what you're looking for, you can easily change those to what you're familiar with seeing. And you just generate it and save it to your computer, and you can use this for your STEMI meetings or to share with your cardiologist or quality department. Okay, this next slide is another download that I did, and this one was focused more on the discharge. So we know that most hospitals can get their patients in and intervene quickly, but we also need them to do things that will improve their quality of life afterwards as well, and hopefully keep them out of the hospital. So there's on here, there's the cardiac rehab ordered, was smoking counseling done. You say no here, but they weren't a smoker, so you're okay. It also has their EF. And then it has all the medications that should be prescribed at discharge, like the ACE. Yes, there were no contraindications. And it goes through each one of those. And this is one that I created. This is what I selected. Yours doesn't have to look exactly like this. You can pick and choose and then generate the report and download it to your computer. This report was so exciting to me because just to be able to enter your patient into your registry and then automatically create this with a download and not have to focus on going in and manually typing all this in once again, but into a separate Excel spreadsheet. So I was excited when I saw that video. Historic upload of data. If you sign up by November 1st, you are eligible for a free historic upload of your data. We can send you the instructions now on how to take advantage of this offer if you are interested. And there are some vendors who will offer transmission of historic data for sites. So if you're wanting to move over your action data, you are able to do that. And then just real quick to go over Mission Lifeline recognition for 2018. You are only required to enter 1 quarter of data into Get With the Guidelines CAD in 2017 to meet volume criteria and measure criteria to maintain award level in 2018. And then if you want to enter 2 quarters, you can increase your award level status. And this is for 2018 only, that we only require 1 or 2 quarters of data. Awards and recognition. The U.S. News and World Report magazine recently released a list of hospitals who met silver or gold level status for Mission Lifeline. We have some advertising that your marketing department can use for Facebook and Twitter. And one other thing we provide is QSI consultation and field staff. So each quarter we send out quarterly reports to the STEMI coordinators or abstractors, and it's just a snapshot of where they are at that particular quarter whenever we use the data to create the report, and just to show them where they are, and maybe they need to go back and look at a few things and see if adjustments can be made, if something was entered incorrectly or something was overlooked. And then 2 weeks following that, we have a quality exchange. And our next quality exchange will be November 2nd at 8 a.m., and it's a call where you call in and we discuss best practices, any updates, have time for question and answers if you have any questions you'd like to discuss concerning Get With the Guidelines CAD. So in the next couple of weeks, we'll send out those reports, and then on November the 2nd at 8, we will have the quality exchange. We are always available if you want to contact us by email or phone. If you have questions, we can help anytime. And then save the date for scientific sessions. We will be celebrating our award-winning hospitals in November in California. Our next webinar will be on Tuesday, October 17th at noon, and this one will be focused on the STEMI Referral Hospital. So if you have referral centers that are feeding into your PCI center, I would encourage you to share the webinar invite with those referral centers. We'll discuss the measures that they need to be meeting and what's needed for recognition and award status through Mission Lifeline Get With The Guidelines CAD. So that'll be Tuesday, October 17th at noon. And I think now we can open it up for questions. You can either type a question in the question and answer box, or you can come off mute by hitting *6.
Hi, Kristen. Can you hear me?
Yes, I can hear you.
Okay, I'm sorry. Is this going to be available for hospitals if you know, I'm watching this and other people in my facility want to see this but they couldn't jump on today? Are we able to have access to this to show them, or?
I believe this will go out next week. But unless we have a lot of questions, if they want to go get them and there's something particular, like are they wanting to see it right now?
Well, I'm wondering if they, you know, I know that I'm just going to have a couple of people that are going to need to see this. And so I was just wondering if my hospital can pull this up at another time, or it's going to be available to watch.
Yes, I believe that will go out to anybody that registered next week. Wani, are you on? Can you confirm that?
Hey, Kristen, it's Audrey. All slides and handouts will be sent to the attendees within a week of the call.
Okay.
And then you can also visit www.hart.org/SWA Equality to view the recording of today's webinar as well.
Thank you guys so much.
Mm-hmm.
Just a reminder, if you have any questions, please press *6 to come off mute.
Audrey, can you put that last slide back up, and whoever it was that was needing to show someone in their hospital, they can reach me by email, and I could probably do a demo for them whenever it's convenient for them. Okay. So if you have questions and you receive the slides, or you don't want to wait until you actually get the slides next week, you can reach me at kristen.waller@hart.org, and I can discuss anything that you saw today and, you know, do a demo for you as well. If there's something particular you're wanting to be shown, just feel free to reach out to me.
Yeah, this is Lonnie. Audrey or Kristen, are you able to see if there are any questions in the chat box?
I cannot see the chat box. Audrey, can you?
One second, let me check.
Okay.
We have nothing.
Okay.
Well, thank you guys. Just a reminder, the third webinar in the series will be held on October 17th, and please visit www.harts.org/SW Quality for information on how to register. Thank you all.
Have a great day.
Thank you.